We're very honored and feel very privileged to be able to present our Seniors IQ program to everyone today. My name is Dale Fiedler, and I'm with Southern Illinois Healthcare Foundation. And this is Felicia Cohen, who's also with Southern Illinois Healthcare. I was wondering in the audience, how many of you have sort of a dedicated seniors program in your health center or housing providers? Okay, about almost half have programs. And if you don't have one now, you maybe have a little bit of an interest in maybe learning a little bit about how to kind of do one, and may go back to your health center to implement one. Yes. Kind of. Yeah. Okay. Great. I also, before we go too far, really want to commend the Bureau. I don't see any Bureau staff in here, but this is really great to be focusing on issues around aging, and I think this morning's program really highlighted a lot of broad issues, and what we're going to provide this afternoon is taking it down to a little smaller kind of scale in talking about one program, how it works, how we developed it, and hopefully provide some conceptual things that will be of use to you, some best practices, and then we also go into some future sorts of recommendations for policy folks. Let's see, where's our clicker? Oh, thank you. This is state of Illinois. This is where our location is. It's in East St. Louis, Illinois. We're right across the river from the St. Louis Arch. Those of you who are baseball fans, last fall got to see a good little bit of the Arch and downtown, and hopefully here in 2012 you'll be able to have that opportunity to see a good bit of it again. But a number of our health centers are located within a close proximity of the Arch. I can look out my window and see the Arch. But we're all on the other side of the river. They're in East St. Louis. Let's see. Southern Illinois Healthcare Foundation, it's really not a foundation that gives out money. The people who set up our health center called it a foundation, but we're really a direct service, 330 health center. A couple little unique aspects of the center. Our Community Health Center Board appoints the board of a safety net hospital in our area. We have a residency partnership with St. Louis University, family practice residency. We provide the cooperative extension services throughout 51 counties in southern Illinois, and that's the relatively new cooperative extension services to help critical access hospitals and private physicians achieve meaningful use. We're also involved with the health information exchange. We led the development of our regional one, and also provide administrative services for another one that's 100 miles away in central Illinois. We have two HUD-funded Section 202 apartment buildings, a total of about 125 units, and but with all of that, we're like many other health centers in that only about 7% of our patients are over the age of 65. This is the growth chart for the Seniors IQ program, and this was what we feel really validates that what we're doing works, that it makes sense. It is growing very rapidly. You'll see that at the end of last year we were at 1,100, and now we're around 1,600 as of just last week or two here. What it really does not show, though, is that in the beginning, we did have some challenges, and the first staff person that was hired to implement that program, it didn't work, and until we got Felicia, who came in October, and basically from October of 2006, she basically kind of almost tripled the number of participants just in about a year and a half, and a little over that. So that's why Felicia is going to talk in just a little bit and actually tell you. I'll whatever, tell you anything, but Felicia will really tell you how it really works. Let's see. Yeah, I really wish that I would be able to stand here and tell you that we were so attuned to the needs of the community. We recognized this, and the seniors program just bubbled up out of a good community kind of organization, and that honestly it was not. We responded to an RFP that was being given out by a local foundation, and a real key element of that local foundation was of their RFP was how to keep seniors living independently. We did, however, as all good planners and things, did look at our social determinants, our local networks, consortiums, talked with our board members, and the bottom one for many health centers, it's really a little bit of a foreign area, the home health services. But if you're going to do a seniors program about keeping seniors living independently, the home health provides a wealth of information. They know what it takes. They know when their services they get reimbursed up to a certain point, and they know that there's still needs that those families frequently have. So they're very, very, very helpful. Just a few of the social determinants in our area. It's a medically underserved, very high poverty kind of community, and everybody's familiar with social determinants, pretty much. So, Kresge Foundation, Robert Wood Johnson, CDC, all just wealths of information. And it's important to know your target audience, or your seniors, or whoever you're trying to reach. It's important to know their education level, the literacy level, poverty, so that the services that you design can really appropriately meet those needs. Now Felicia's going to go into a little more detail.
Good afternoon, everybody. I'm Felicia, and I'm going to move forward here. Basically, like Dale said, when I was hired to come to Southern Illinois Healthcare Foundation, I also represent Touche Regional Hospital. I was brought into a situation under a grant to be able to bring in seniors into a program like within 6 months, to be able to get 100 and something seniors into a program within 6 months, because they already hired someone who worked 6 months and then they had to let them go. So I came in, I started to say, well, how am I going to do this, And that's when Dale said the social determinants. I knew as a social worker, that is my background. I'm a social worker. And I know as a social worker, you know the community, you know services, you know resources. So I thought to myself, well, I'm going to a hospital, I'm going to a health center, multiple health centers, and they have a home health department. And when they wrote the grant, their number one focus was home health. They thought they were going to get all the seniors from the home health division. But knowing social work, I knew that would be a part, but I knew that was going to be very difficult to get seniors 65 and older coming from a home health division. So after we did our analysis of the community as a social determinants, I focus in on the heart of the seniors' needs. In the East St. Louis area, which is a very low-income, poverty community, we focus on economics, the seniors themselves, and their medical, okay? And once I was able to identify the social determinants, the main 3 focus areas, then I took it a step further, because I had to figure out, how am I going to get seniors to buy into what we want to sell them, basically, and that's health services. How are we going to help them to become more knowledgeable and empower them to want to improve on their own health and wellness? Because when I first came to East St. Louis, they told me, oh, this is a very hard to serve and access community. And I said, really? Okay. But I think people are people. If people like what you're talking about and it's really going to deal with their core issues, they're going to be open to what you are talking about and receiving health services. So I went and I said, what did we do to create a successful program? I focus on 4 main steps. Step 1, identify the needs and influencing social determinants, which I just spoke about, of the population you're serving. Step 2, identify partnerships, figures, organizations that could help me. Again, that's when my social work background kicked in. And I said, well, who's out in the East St. Louis area and the surrounding communities that could come in and to help me to help the seniors and empower them and educate them about the health services that they need as they age. And step 3, develop a program that provides convenience. You know, a lot of times I was being criticized at the beginning because people were stating, well, you don't want to handicap the seniors. You don't want to do too much for them. I said, okay, let me just, keep it going for a minute, and I would show them that it's not handicapping them. Sometimes in a low poverty community, the literacy rate comprehension is very low as well. So seniors may not even understand or recognize what you're even stating to them. So you have to make it convenient for them. So you have to know your population. Again, you have to know who you're serving, the educational level as well. And then step 4, developing a strong marketing campaign. One thing I like to do, I love to talk. I love to talk to people and educate people about the services out in the community. So I did a lot of advertisement. I did a lot of community outreach because you have to go to where the seniors are in their community. And as you heard some of the presenters earlier, that's what they stated. One presenter stated, you have to do a lot of community outreach. You got to go out there and touch them, okay? Because if you're sending some of the advertisement, maybe they cannot read. And when I came to East St. Louis, we got in contact with Area Agency on Aging. And basically they told us, well, how we communicate with the seniors, we do billboards, we send out advertisement, we do radio advertisement. I said, okay, but what if seniors do not listen to the radio station that you listen to? And again, if the literacy rate is high, are they going to be able to read a billboard? So is that really, really focusing on this community that I was told was hard to serve? Okay, step 1, basically what we're going to do next, I broke down each step, the 4 steps I just talked about, I broke them down so I can be able to focus in on them to implement and develop the program. When we did the social determinants and our assessment of the community, these are the things that's in the East St. Louis area and the surrounding community that the seniors had a tremendous amount of problems with and interest in. The first 3, anybody know what the circuit breaker is, Illinois Cares? Okay. Circuit breaker it basically helps seniors with their prescription drug plans, their health plans, and also gives them a cash grant to help them with some taxes on their homes, different things of that nature. And if you get a cash grant, I think it goes up to $720 a year. Okay. So in the East St. Louis area, the seniors want this done annually. But the problem was, a lot of seniors are handicapped in wheelchairs and have transportation problems. So are they really going to be able to get out and get these services done? So a lot of them go without getting their circuit breaker, and they're in the wrong health plan. They're in the wrong Medicare prescription drug plan. So they're paying money out of their pocket that they maybe cannot afford because they didn't get the right information. So I'm just giving you some examples. And another one was really, really huge in the population was the shower bench, high-raised toilet seat, and emergency lifeline. A lot of seniors, and that's what got them to come out and listen to what I was saying. When I said emergency lifeline, because a lot of seniors live by themselves. And if they're able to press a button to get help or what have you, and we made it easier for them to get the devices, the convenience part of it, then they were more open to coming out and listening to what I had to offer them. Step 2, identifying partnerships. And that's what I did. Organizations, agencies, programs that go out and immediate needs of the population, strong networking skills to identify possible collaborations, and that's what I did. AARP, I think one of the presenters earlier in the conference spoke about AARP. They have a senior employment program, seniors working with seniors. And if a senior is coming out and educating you on services, did you get your mammogram? I just had mine. Really? Yeah, I'm 72. Well, I'm 69. So a senior being able to identify with another senior, receiving services, and they're working, that's going to empower that senior and motivate that senior to be able to listen to what the Seniors IQ program can offer them. We also work with senior apartments, senior centers, churches, the YMCA, which a lot of seniors go to the YMCA. So again, we did a lot of services in educating the community before we implemented the Senior IQ program.
Just real quickly, I wanted to go in just a little more detail on the medical legal partnerships. And from the response on the question, not really a whole lot of people know about these. Is everyone familiar with the Legal Services Corporation, legal aid in your area? Yes. Legal aid, they've been around for one of the 60s programs. What they provide is legal services for disenfranchised populations, and they're affordable legal services, and they're in most every community. I know sometimes they cover a very broad area, so there may not be an office in your town, but your town is served by an office of the Legal Services Corporation. They have a relatively new program. It's called Medical Legal Partnership, and this is exactly how the definition really appears on their website. And I'll just read that because it just kind of fits. Medical legal partnerships integrate attorneys as a vital component of the healthcare team. And I always told these people, you got to get a different kind of title. Medical legal partnership. They don't go together very well. Generally it's adversarial. And but this is really one that's a partnership, and they assist us in many aspects. And you'll see on the slide the website that you can get all kinds of information there. And I have one more little slide on ours, but it's a whole nother kind of presentation. Really, each medical legal partnership is really unique, and you want to base it on what your needs are in healthcare and what their needs are that they want to have met. And in our particular situation, they were trying to do a survey of the senior population around. They were looking at elder abuse and some aspects of that, and they were challenged to get enough people to respond to their survey. And well, that was, yeah, we can help you with that. That's no problem. So kind of immediately, that was kind of the first kind of a win situation that we have with them. And let's see. One of the issues again that's really important around seniors is that whole issue around power of attorney, guardianship. They can provide that service for free for people, and rather than individuals having to pay a high legal fees for that. They're also another thing in healthcare where we see an advantage of working with and supporting the medical legal partnership is around that whole area of disability determinations and Medicaid eligibility. For the health center, it doesn't amount to a whole lot of money, but if you have a hospitalization involved or tests, x-rays, etc., that is where you can basically, over a little bit of time, turn what is a non-pay patient into a paying Medicaid disability patient. So that's a benefit on medical legal partnerships. And they also provide very good services around that whole elder abuse, which I'm sure is an issue in your communities also.
We added that and kind of threw that in the middle there because the legal aspect and a lot of things that the seniors go through, aging and knowing that you have income that exceeds the amount just in case you probably need to go into a nursing facility. Do you want all your money to go to that nursing facility or what have you? So that's when we start looking at power of attorney, durable power of attorney that's deal with the financial as well as the medical. We should really start educating the seniors to, do you have a family member that could be a durable power of attorney for you. We really kind of, advise them to start transferring things into maybe your sons and daughters' names and different things of that nature way before that age, before you go into a nursing facility. Because once you go in that nursing facility, all your assets has to be turned over to that nursing facility. A lot of times, when we educated them in the legal ramifications of different things is if you're married, a lot of times the spouse thinks that his or her finances are going to decline if a spouse goes into a nursing facility. So we bring in the legal aspect of that and educate them. No, a spouse income level of care cannot decline if another spouse has to go into a nursing facility. But you have to have the legal partnerships to be able to get that information to the seniors and educate them. So that's kind of why we kind of threw that in there, because it's very important having that power of attorney, your will, having all those, your ducks put in a row before you get to the age of possibly going into a nursing facility. Oh, let me go back. So step 3, how to make receiving services convenient. Well, I broke that down a little bit further. Becoming a one-stop shop method. Again, I heard that stated out, and one of the presenters stated that earlier. If you are able to partner with a lot of organizations and agencies in the community, such as Area Agency on Aging, the different services that they offer, maybe it's in a location where your seniors cannot access. Well, if you partner with them and you're able to complete some of the paperwork or get their applications and do some of the things that they normally do in their office, which were maybe difficult for the senior to get to, if you are in a partnership with them, they will have you to, they would agree to have you to complete the enrollment programs, the enrollment forms, applications at your site, as long as they get credit. You don't want to take anything from them where they don't feel like their organization has their name out there or they're not getting credit. But they're getting the seniors. So if their accounts go up because we're able to complete some of the application at our site and be able to give that information to you, that means it's a win-win situation. Your agency is getting the numbers and getting the paperwork done under your grant or whatever your rules and regulations are, and so are we. So it's a great partnership. So completing enrollment forms, application, in person and verbal, because you have to have forms that need to be completed verbally, because seniors are not going to always be able to come out to your program. And when I first started to search out partnerships, a lot of times people didn't want to partner because they wanted the seniors to come out to them, because they were saying you're handicapping the seniors by making it too convenient for them. But then I said, but you got to be realistic. Seniors are in wheelchairs. They are, don't have the transportation. There's a lot of things that could prohibit a person from coming to your organization, and you can't view it as handicapping them. You got to make it convenient. And seniors want convenience. I know I would. If I'm 65, I want some assistance. So obtain forms from agencies that offer services to your population to save time, even if you have to get a release of information. So I can release information to your organization, and you can release information to my organization, and that senior is able to sign off on that. So we can be able to communicate. So we won't violate any HIPAA policies. Provide answers on aging, be able to have the senior to call you, to be able to ask those questions at your office versus they're going to Area Agency on Aging. If it's an agency or program that's in their community and they're able to access it versus going somewhere that's some distance, that's making it convenient. And I'm fortunate enough to work at an organization that we have a full transportation department. So when we have health services or health events that we're trying to get the seniors to go to, and we're able to set up transportation for them, that of course encourages them to attend their appointments or a health service that we provide, a presentation or a group meeting or something of that nature in the community. And reminder calls and letters. Seniors always appreciate you calling and making sure that they keep their appointments on time. A lot of times they forget, and they're so happy that you called and remind them. This is how we developed the Seniors IQ program. Examples of services provided. These are some of the services that we provided at our one-stop shop method in the Seniors IQ program. Advocacy, of course, case management for seniors. And we were fortunate enough to have a certified information and referral specialist for the aging. Anybody know any visuals like that? It's only a few in the U.S. And they are certified where they are educated for Medicare and Medicaid. They're certified in Medicare and Medicaid information, SHIP and SHAP services, basically senior health insurance plans and seniors health assistance plans. They're educated and certified. They can call the Medicare department and get answers and questions that I, a normal person, would not, because I'm not certified. So she is the one that has the duty of answers on aging. So when a senior calls the Seniors IQ program and they have questions about their health care, questions, does my Medicare cover my mammogram, questions about my well woman, do I go every year? No, you go twice a year, well, once every other year for your well woman. And so that person is able to tell her directly what services and health services that you are allowed to have, because she's a certified information referral specialist. And everybody's not able to get that type person, but if you're able to get someone to go through that training, it would improve on your program and help to make it successful. So you can read the other things that we provide in our one-stop shop at the Seniors IQ program. Step 4, a strong marketing campaign. The first one, choosing the right manager for the program. Of course, because they chose me. I'm just joking. But because I came with, at that time, 15 years of experience dealing with the seniors population and developing programs. I developed programs for seniors with housing. I developed programs for seniors in just an array of services that they need under several different grants before I came to Southern. I also worked in the homeless program. We developed senior services for the homeless. So I was able to come and be able to recognize, again, as a social worker, the different partnerships that I can, that could assist me to develop the program. Brochures, newsletter, we didn't have no brochures, no newsletters. And you saw on the scale back, a few slides back, the growth went from 110 to 300 to 800, and we're at 1,600 plus now. And you can't not call 1,600 people and tell them, okay, we're having a health initiative on this day. You can't do that. So your communication to your population is through the newsletter. The newsletter is your communication. It's going to tell them when, where, and how. Because that is what we had to develop, because we cannot pick up the phone. We do not have the staff. Grants come and they go. So you have to utilize what you can to be able to continue to make those seniors feel like they're valuable and that they're continue to get the services that they need to have as they age. And then, of course, Facebook, presentations, open house, networking is big, and developing your own health support initiative for seniors in the community. Helpful marketing strategies. Create your own initiative. I just spoke of that on the last bullet. Plan to present senior service program in a group settings to maximize enrollment. What I mean by that is basically, I really am not a fan of a health fair, okay? And when I brought that to Southern, they looked at me like, what? What do you mean, like, why you're not a fan of a health fair? Because you have a presenter, you give out trinkets, some information, you have 20, 30 vendors, and then you send the people home, especially if they're seniors. And if they're having any comprehension type literacy problems, what are they actually gaining? What is the knowledge that they're actually receiving? So basically, I started to create health initiatives. When you do your social determinants of your community, you already know what your community, your population needs are, whether it's health, supportive services, energy assistance. You already have a great understanding. You're not going to know everything, but you have a great understanding what your population needs are. So for its health, I know we have a certain amount of women. Everybody is that age to get a mammography, and they're a well woman. And we even had to educate them on the well woman, because a lot of times women 65, they stop getting their well woman because they just decide to stop. But it wasn't from the direction of their PCP. So basically, we start setting up health initiatives like a wellness day for women, wellness day for men. We broke it down further, wellness day for men, PSA, or something to that effect. So we can continue to have health initiatives throughout the year. And we try to gear it towards what month it is. October is Breast Cancer Awareness Month. September is Prostate Cancer Awareness Month. So we start doing different things about diabetes and different things of that nature. And where they can come out and they actually receive a service, I have primary care providers available or on standby at the health centers to be able to get them the education, the information that they need, and also schedule them to see a provider for their mammography, for their well woman, to get their PSA screening. And when you have this in some type of marketing strategy that's focused on something that's particular to that individual, you will maximize the participation versus having something broad. Because when you have something too broad, they don't receive the individual needs. Their individual needs are not really being met. So that's why when I create some type of health initiative, they've really been very successful. And that's why I can stand before you and say we have 1,600 people in the program, and it's been around for 4 or 5 years. And I came in at the end of October. And when I came in at the end of October and they released the person before me, they had 0 people in the program. So I had to start from scratch. So again, don't wait for a health fair to invite you to offer your service to the community. Create your own ideas. You know your population. You know what their needs are. Or send a survey out to them. And gaining seniors' trust. You know, seniors are, they're very particular about who they welcome into their home or welcome into their lives. So follow up. One thing that I really focused on when we offered a service to a senior, we made sure that person, that company was reputable and that they were, the services that they said they were going to give to the senior, that it was received and hopefully in a positive way. And we contacted the seniors afterwards. Did you make it to your appointments? How was it? And sometimes they probably said, you know what, I didn't make it. I forgot. And they didn't let us know. So we have to reschedule. But they appreciate the fact that I called. And they said, oh, I didn't even think you were going to call again. But once I start that routine of gaining their trust, the more came. More people called and said, I'm hearing about Seniors IQ program. I'm hearing that you're able to do this. You provide transportation with that. And I need to go and get my colonoscopy, so on and so forth. And that's how we start getting the phone calls. Okay? Communication, again, is power. I made sure that me and the staff that I have, that we had direct dialogue either with the senior or their responsible party. It's always good to bring in that family member, that responsible party, so we can keep everybody in the loop on what's going on with that senior, so that senior, him or herself, can feel important and well taken care of. Okay? Making seniors feel like they are very special in their golden years. That is my goal. I want them to feel like they're special. They're 65 and older, 60 and older. These are their golden years. Who wouldn't want to feel special at that age? Okay? How to measure if a program is reaching a senior population. So we do a survey. We survey on these particular ones. How did you hear about the program is the #1 answer that I look for. Because when I do all these surveys, I go back to the #1. Because if you tell me I heard about your program from a family, friend, a church member, that means the seniors are telling other seniors about the services that they're receiving. So that means what you're doing is effective and it's working. For the first year and a half, I did a lot of pounding the pavement, getting out there marketing. After a year and a half, I did not have to do any more pounding the pavement. I sent information out through my newsletter. I did not have to go out to the community and do the marketing anymore. Because who was my best marketer? The senior themselves. When they called, I heard from my sister, who's 72. I'm 74. I need this, 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 this. And then we move forward. And that's how I got the seniors in the program. Because they heard about all the services that I just showed on the slides, and that they received good service, customer service, professionalism, as well as the personal touch. You have to have that personal touch. And then also staff evaluation. That's how I find out if my staff, the courtesy, if they're effective, if they're polite, if we have somebody who's not doing what they're supposed to do, so we can be able to manage that as well. Because I don't want to stand before you and say that we didn't have issues, but they were so minor that we were able to bring this program out, and the seniors are very happy, and we are extremely happy.
I think we've covered a number of these things, but it's just sort of remember that seniors are not interested in encounter numbers, user numbers, readmission rates, bottom lines. They're interested in keeping the heat on, and if nothing else, take that away from the presentation. I think these slides will be available, and we have covered a number of these. I don't know just how much time we have left. 15 minutes and maybe have a few minutes for some questions. Okay, just challenges. You kind of hate to always kind of say that funding's a challenge, but it really is. You just really can't unless you have adequate funding. The local foundation so far has been very supportive, but I really don't know how much longer they're going to really be able to continue their support. We've I think kind of hit those other challenges already. Wanted to just focus on a little bit of kind of some of the near-term sustainability things. Stay lean. Just you know that you got to keep these. You want to try to keep these staff employed. So you utilize a lot of communities have retired senior volunteer programs. You want to use those as much as possible. Wanted to also just touch on the. Does everyone know the IRS Form 990? What, if you know it, raise your hand, and I'll less. Okay, many of you do. But for those who don't, real quickly, it's a form that every not-for-profit entity fills out each year, and it demonstrates to the IRS that you are indeed a not-for-profit. Now, hospitals have received some increasing scrutiny. There's an additional form, Schedule H, I believe, is the form. And what they have to do now is to demonstrate that they are providing what's called community benefit. And some hospitals have lost their not-for-profit status or have had to keep their status but pay real estate taxes in the community where they're located because they had a lot of excess revenue. Let's just call it that. But what that does for senior programs, the opportunity that is for you, and it may be, each community is different, but they have to document their community benefit. And if you approach them with a senior program, and these are the benefits, and we can help with disability determinations and this kind of thing, they may be very interested in supporting that. It certainly is worth the discussion, because they really are under the gun to document that they are providing a community benefit. Also, as was indicated in the presentations this morning, under healthcare reform, those entities that can put together an array of supportive services that's going to help people to stay in their home or not go back into the hospital, those kinds of entities will have value. And I think this is going to be coming in the near term. So if you have a strong entity already in providing those supportive services, or at least knowing where to get those services, and can get patients, if they're discharged, linked up with those services, I think that's another niche opportunity for these kinds of programs, and especially around seniors, because seniors have that's where the hospitalization rate is higher there in that segment of the population. Looking at kind of the future, do you know that today, April 30th, there's 10,000 people turning 65 today. And this is going to continue tomorrow, and for the next 20 years, many of us are going to be hitting those years. And also, the other part of that is that people who are living to 85, they're going to be living longer too. So this is going to create this real big demographic shift, and it's a shift that we as health centers, I think, need to begin to do some things differently. In our health center, only 7% of the patients are over 65. Yeah, and that is what the national average of all of them together is only 7% of the patients. And as I started to put together the slides and prepare the presentation, it was like, well, why is this? And is it really out of tradition? I mean, we're moms and kids. We've been successful with those programs. We've reduced low birth weights. We've done those things. It's been very, very positive. Are we just totally oriented that way, and we really don't think about senior issues in our health center culture? The reimbursement policies, while not directly, influencing how patients that you're going to care for, but as an administrative type, if you can see moms and kids and a bunch of visits, that's healthier for the bottom line than seeing many fewer patients and getting the same amount of revenue per encounter, per PPS, under the PPS rate. But if you have seniors, there you have to begin to address the musculoskeletal system and the circulatory system and the pulmonary system, multiple things, and so you end up spending a lot of time with those people, and you still get the same kind of reimbursement. And not that it's not that that's a design or anything, but I think it's really present in our in health centers. Let's see. Yeah, and there are exceptions. I mean, in ours, we have a homeless program also, and so we take care of people with multiple needs. But and a lot of there are a number of seniors that come. But I think it's just a kind of a fact of life kind of thing. Facility design. How many in here have at least one health center site, one location that has a covered area where people can drive up? Get the wheelchair out of the car and around, get the patient in there and wheel them in, but it's under a covered entity. It's covered. People can stay out of the rain, out of the snow, what have you. How many have at least one site like that? 1, 2, 3, 4. Yeah. That's what I thought. We only have one out of 5 sites. We just don't think about the needs of the seniors, and it goes even into the design of our facilities. Let's see. Losing my. Access to specialists. I don't know about your health centers, but we've always been challenged on access to specialists. If you're going to serve seniors, you've got to have access to specialists. You got to have the patients are going to be in the hospital a lot. You got to have physicians that want to follow that patient into the hospital and take care of that patient. And most of ours do, but I know that there are some other health centers. I know that the physicians only just work at the health center and refer the hospitalization needs to a hospitalist or somebody at the hospital. And that's really not my opinion. My opinion. It's really not the way to care for senior patients. You want to follow them to the hospital, but that's work, and that's just another aspect of caring for seniors. I think a challenge for health centers. You also have to have access to PT, OT, all the other types of services that are ancillary to caring and getting people functioning better. So being very close to Washington, D.C. here and having a podium, I just have to come up with some policy recommendations for Kevin in the back here for the feds to consider. I think that one way forward would be, rather than just kind of myself kind of surmising as to maybe why health centers only have 7% of patients over 65, perhaps we should conduct a study, as all good things do, and have that be a jointly sponsored study conducted by whatever the most politically appropriate firm is to do that, The Bureau knows all of those things. I don't purport to know, but there's some entities that may that maybe should be involved in such a study, and determine the reasons why and develop recommendations on how to serve. What do we need to do to serve more people? As a suggestion from just again my own little surmising there, maybe they could replicate the special populations approach, and a couple years ago there were the enabling services grants, and I think some grants along that line, oriented to aging, oriented to care coordination, oriented to those wraparound kind of services. I think wellness. I think those would be that would be an appropriate way for the Bureau to begin addressing aging programs. The other thing is that I think we have to engage technology much more than what we do right now. Just a couple days ago, I saw a demonstration. This firm provides, they provide after-hours physician services in nursing homes. And they don't have a physician in the home, they do it remotely. And they had a unit where a nurse's aide in a nursing home can come and put a wand over the patient's chest, and the physician who's located remotely indicated that he could hear better through the remote transmission. He could hear better through that than if he had the stethoscope right and was listening to the heart. And this was the person who was providing the service to. But I think there's I think there is a real kind of grain of truth there. I don't think it was all just for show. The other part of that machine was an otoscope, and for the demonstration, he focused on the guy in the back of the room, and it goes with a camera and the little light, and asked the guy to kind of turn his head, got his ear, and kind of blew up the ear on the screen. It was just really phenomenal. But what we need to do is, as health centers, we need to become more aware of all of these different kinds of technologies, and as they go forward, that machine, it was a pretty good size machine for the demonstration, but I'm sure that in the future years that would even be able to be in a basically kind of carried in a box. And what my kind of suggestion for this is that either within the Bureau or within some other part of the federal government, that there would be a sort of a central clearinghouse on what are the technologies that enable people to stay in their homes. That we not only need to be kind of aware of those, but I would also sort of suggest to have one of those rapid cycle evaluations. Is this effective or not? And you could have it as just kind of preliminary, yes, this preliminarily, our rapid cycle looks like it's a positive thing, but continue on to have more definitive information over time. But getting it out and letting that healthcare provider decide whether this would work for this patient in their home. I just think it's a phenomenal kind of field to that whole development of technology and the things that are going to assist us in remaining in the least kind of restrictive environment as we age. And just another aspect which isn't directly related to health centers, but it might be a niche that health centers may want to kind of evolve and develop into, and that is providing various levels of care within an assisted living. Right now you have a nursing home, or you have assisted living, or you're in your home. Well, there's a whole bunch of gradations in there, and especially being able to apply appropriate technologies along with the proper kind of care providers. you know, I just think that's an area that we need to need to look at and develop policies around that, and have, you know, basically greater intensity of services, and you get more reimbursement for those greater intensities of services. Please.
How are you paying for your attorneys?
Under the legal services, the medical legal partnership, the legal services have taken that on. You know, it is a federally funded program, legal services, and they are using a person as a liaison through the VISTA program, and we've had it in place for almost a year now, and that person is going to be able to do it for another year. So it's through the VISTA program, and ideally that's going to, we'll be able to demonstrate that there's been enough revenue generation through the disability determinations that it would be a cost-effective program for the system to continue. Question. Keeping our fingers crossed on that. Yes, question.
Just a comment and then a question. I think that you touched on a very important aspect of why it's only 7% utilization by seniors. It's the chicken and the egg thing. The centers are geared toward families and children. It's more, I believe if you build it, they will come type attitude. You need to create an infrastructure that would be senior friendly. That would be a big draw. For example, locally at Holy Cross Hospital in Montgomery County, Maryland, they created the first ever senior emergency room. That's just for seniors, and it's been tremendously successful. But they've had to invest in the facilities, in the training of the staff, in the availability of the actual design that's senior friendly to then bring those seniors in. But it's really hard because if you don't have the seniors, how do you then justify the creation of those? So I think I'm just touching on the complexity of the inception of those programs.
Right.
So just I thought that I had my
Thank you. That's great. That's yeah.
Ongoing struggle. The
Yeah.
second is more of a question about your technicality and the program. How many staff do you have? What's your budget for that particular program?
The budget is around 75,000, a little bit over that. We have one full-time staff person, a part-time, and a couple of volunteers.
Thank you.
Yes.
Quick question. I noted that many of the services that Felicia had mentioned are also offered by AAAs and the ADRCs. So how are you leveraging so that you're not duplicating services, but instead leveraging resources? So are the AAAs referring to you? Or just where does that partnership take place?
The AAA in our area covers about 7 counties, and they were having their office is located about 15 miles from our target area of East St. Louis. And so we brought the services to the underserved community. They were having trouble reaching the population. And
so we have a communication with them.
Yes, yeah.
Yeah, and we refer to them, they refer to us, but they are very happy that we were able to reach the community that they weren't able to.
And again, it's not to take anything away from them, you know, but yes, ma'am.
I don't know if you mentioned it or not, but are there programs or sources for seniors that are caring for their grandchildren or even maybe a child that has a illness?
You talking about you're not talking about
because
the foster?
I know in many of the poverty groups in the area, in cities, a lot of grandparents are taking care of grandchildren.
Well, we have partnered with the foster grandparent program, so we work with a lot of organizations that deal with seniors as well as their children. Since we have the health centers that deal with the families and the children, and we have the Seniors IQ program that actually deal with the seniors, so we partner with both parties and be able to provide for the entire scope.
But yeah, I think you do raise an interesting area there. That would be a very good program to really provide some more supportive kinds of things to those grandparents raising the kids.
And you also need community health workers in your area.
Yes.
That's another program. We do have community health workers that from the health
You
centers.
said that you went out into the community.
Yeah.
And I was thinking that if they were available, they could go out.
I don't do
Yes.
it anymore, so
Okay, I
no.
mean before.
Yes, sir.
I just wanted to ask Ms. Jackson if you're having someone interested in becoming one of the certified information referral specialists, who do you contact?
You can contact me, and I can be able to connect you with our certified referral specialist, and she will be able to give you all the details you need to have to follow through.
And that's available for anyone anywhere in the country?
She will be able to answer that question. I don't know if it's
Oh.
anywhere, but on one of the slides it have my email address. When we get through with the questions or
okay.
what have you, and I have a card. You can just call me anytime,
Thank you.
and I get you set up.
Yes. Yes.
Are you mentioned about one of the suggestions was care coordination with hospitals, and they also mentioned it's also one of the initiatives, pilot projects, the care transition program. Do you all have a program like that, or are you planning to, or have a relationship with?
We were not, we did not participate in one, as we didn't apply on that Innovation Center funding, so we're not funded for that. We do have the Seniors IQ program, and right now we don't have the care coordination part kind of all formalized, but that's certainly a priority for the coming months there. But conceptually, it fits. You know, conceptually, it works. Yes. Oh, I think yours was up early. Yes.
I just wanted to have a quick follow-up to Ms. Jackson, the point that you made in terms of your marketing. I wanted to ask you if you formally partnershiped with churches, barbershops, hairdressers to kind of get the word out initially.
Sir, I partnership with everybody, the Urban League, Salvation Army, Leslie Bates, if you're familiar with East St. Louis, numerous churches. I'm a part of their National Congress district, which we're getting ready to put on a wellness day that's coming up. That is the key to keeping your name out in the community when you partner with the like the YMCAs and different things of that nature, and the senior centers. And like Dale stated, we have 2 senior buildings that house seniors, so we definitely partner, with them, as well as other senior buildings and assisted living and different things of that nature. Everyone, every agency, every church that's in the area.
You mentioned that you have about 1,600 members participating in the program currently, and that this is also your last year of funding, I believe?
Well, it's every year. You apply every year.
Okay, yeah. And I was just wondering, is this something sustainability-wise that you would see being an internal program, or would you use that community health worker model to turn it outside of the program, outside of your program, so that it can continue on its own?
Well, I can answer parts of that, and he can answer parts of it. I'm no longer the program manager over the Seniors IQ program. I have evolved to where I work as the community outreach specialist for Touche, which is the hospital, as well as Southern Illinois Healthcare Foundation. So I provide services that's not funded under the Seniors IQ program, but it's through the Seniors IQ program. So again, I'm not being funded under there, but we have expanded where we took it bigger and larger to where we deal with seniors in every capacity, where, like I said, it's sustainable since I'm not funded through them. I'm through another entity, but I still work with the Seniors IQ.
So part of the activities that Felicia does now would be a component that's being funded internally
To the
now. But the rest of that, we would continue. We have another grant that another grant source that we support the person who does the counseling on the ship and shop program, the benefits person. We have another grant. We're just constantly looking for grants. Whether I think that we would try to preserve parts of the program as much as we could, and kind of thinking we haven't really utilized our health workers that much in the Seniors IQ program, and kind of as I learned today from y'all, it's another idea here. Yeah, maybe we need to begin thinking about doing that. Although health workers are not, I mean, they still require supervision, things like that.